Think back to when you were a kid for a second, playing that sport you love so much. Was it basketball, soccer, maybe tennis? What a blast that was, right? Well, as we get older, many of us lose our connection to the sports we were once passionate about because, well, we get deep into our families and careers.
But for Salisbury's newest orthopedic surgeon, sports are why he is doing what he is doing. Dr. Taylor Wiley grew up as an athlete and tells Delmarva Life's Katie Zrilli that he considers his practice to be the perfect combination of his interests and helping others.
Dr. Taylor Wiley is new in town, and he's in the business of fixing people.
Specializing in sports medicine, I take care of hip, knee, and shoulder injuries primarily.
He comes to Delmarva from the New England area and just got started this month working as an orthopedic surgeon at Peninsula Orthopaedic Associates. He was in search of a top-notch practice and believes here he found it.
I think it really started with the people in the practice. All of my colleagues are incredibly welcoming, helpful. We rely on each other and can focus on patient care together.
A former athlete himself and an all-around sports lover, he's passionate about restoring players back to their full potential.
For a lot of these kids, it's really the first hurdle or challenge that they've faced in their life. They've been healthy up until that point, and it's nice to be able to guide them through that, take care of them, and get them back on the field.
But he's not just in it for them.
From the competitive athletes to the weekend warriors to the older sedentary workers who have rotator cuff problems.
Like he mentioned, Dr. W is a knee, shoulder, and hip pro. His first talk with us was centered mainly on knees.
With the knee, I like to tell people the most important thing is just maintaining a healthy weight and also staying active, mainly in low-impact activities.
He says a common knee problem is a meniscus tear. The meniscus works as a shock absorber for the knee. It's C-shaped and sort of acts like a cushion. There are two types of tears. The first is an acute, which comes with an injury. The second is a degenerative tear, which happens more over time.
Symptoms they'll typically find is pain on one side of the knee or the other, the inside or outside of the knee, recurrent swelling in the knee, or sometimes what we call mechanical symptoms, which is locking, catching, or clicking in the knee.
If you come and see Dr. Wiley, the first step he'll take is to do a physical exam.
When examining a patient with a suspected meniscus injury, the first thing you really want to look at is their knee alignment, and you also want to inspect for swelling about the knee. That swelling or effusion can be palpable up here, and that's a common finding with meniscus injuries. You also want to check range of motion to make sure it's full, with the patients often complaining of pain in this deep flexion.
If it appears to be a tear, the next step is to get imaging, which will help identify the type of tear, the specific location, and the pattern of the tear.
For acute tears, if it's a peripheral tear, we will attempt to repair it. Repair is done through arthroscopy, so it's a small digital camera inside the knee with small suture devices that help sew that tear back together and allow it to heal. If it's more of a degenerative tear, really the mainstay of treatment is non-operative, so it's physical therapy, rest, icing, and anti-inflammatory medications to help with the pain.
Dr. Wiley says if you do suspect an issue, it's always a good idea to get it checked out early. All right, Dr. Wiley, we got to get to know you a little bit better. Do you have a family?
I do. I moved to Salisbury with my wife Lori, my 10-month-old son Ethan, and my dog Scout.
Is Scout wild?
Scout's wild.
Do you
Very
like
wild.
coffee or tea better?
I like coffee better.
Summer or winter?
Summer.
And what's your favorite sport?
Soccer.
Yes!
Of course. So are you interested now in making an appointment with Dr. Wiley, or for that matter, anybody with Peninsula Orthopaedic Associates? Well, we happen to have that phone number on delmarvalife.com for you to get.